Hello, my name is Rachel Groves, and I'm an RN. I currently work as a cardiology nurse at a multi-specialty clinic, and I've recently taken part in a collegiate debate regarding a bill called House Bill 185, also known as the SAVE Act. This amendment would allow advanced practice RNs to be able to practice to the full scope of their practice without being overseen by a physician or having to have that partnership with them. This could be a family nurse practitioner, a certified nurse midwife, a certified nurse anesthetist, or a clinical nurse specialist. Now, this is already the case in 22 states, but it has not been approved yet for North Carolina. The bill is currently in the State House of Representatives. It still needs to pass there, then go to the Senate, and then on to the governor. One of the best arguments in favor of this bill passing is the potential opportunity it would give for patients to access health care in rural areas. So patients in rural areas have limited resources available. A lot of times they have trouble traveling to larger cities to see a physician and may not be able to go as frequently. And this would allow nurse practitioners to be able to go into these communities, be able to fill the gap, and ensure that patients there are being able to get their primary health care needs fulfilled. This would be more convenient for patients and less costly for them to see a family nurse practitioner in their area versus going to a larger city for the physician. Secondly, the bill could potentially reduce the risk of rehospitalizations for patients with chronic health needs. So patients that have diabetes, hypertension, they oftentimes, especially after discharge from the hospital, need to be seen frequently to help manage those diseases and adjust medications as needed. And if patients are in rural areas and they can't get to these appointments, then they get sicker faster and they become unstable and they have to go back in the hospital. And so this affects the payment systems. This affects Medicare, Medicaid. They don't like for patients to be readmitted within a 30-day period of time for the same thing. So having a nurse practitioner go into these areas will help keep the occurrence of rehospitalizations lower. Last, the bill is a huge benefit for nurses. I know several CRNAs that graduated from ECU, and as soon as they graduated and got their licensure, they left the state. They wanted to move to a state that had less restrictions on their license, and this is a loss for our state. This means a lot for me as a nurse because I'm trying to obtain my family nurse practitioner license within a couple of years, and it will give me more opportunities to practice as a provider. One of the best arguments against the SAVE Act, though, is the difference in the training and the schooling between a licensed physician and, say, a family nurse practitioner. So physicians have to complete a doctoral level of medical school, and they have years worth of residency that they have to complete before they can go out and practice on their own, where a nurse practitioner has to complete at least her master's degree in nursing, and during that time she'll have clinical hours that's associated with that, but not a true residency for several years like a physician would have. The physician gets in-depth training in these critical areas, and it's more in-depth, so they can recognize things more quickly. So it may be in their argument that the physician may be able to see something, may see a critical component that the nurse practitioner, who is a novice nurse practitioner, may miss. I think that this is a great piece of legislation. I think that it should move forward. I think that the change should happen quickly, especially with everything going on with the United States, with the coronavirus. We've all witnessed a shortage of healthcare workers and providers, and these patients need our help. They need us to go out in the communities and be able to help them. And this would give advanced practice RNs more access to using the full scope of their practice. Some simple changes should be made to this bill before it moves forward to help those that oppose the bill be able to accept it. And that could be that for a short period of time, say maybe 5 years, that there would be a few limitations on the advanced practice RN, that she would be partnered with a licensed physician that would be able to mentor her and guide her for that period of time. And that would help account for some of this discrepancy for the residency versus a nurse practitioner who didn't get that opportunity. And then after that 5-year period of time, then hopefully the advanced practice RN would be able to have those restrictions removed.